This is assessment 14. Hi Pierre, how are you? I'm Marie. It's really nice to meet you.
Hi Maria, how are you?
Very good, thank you. I hope you found our centre easily enough today for you.
Yep, thank you.
My pleasure. So I understand that you've been referred to our centre by your case manager.
Yes, Sam.
Sam, yeah, absolutely. So if we can firstly just go through your individual plan as a starting point, and then we'll go from there. So your details all correct there, and Sam is part of Hillside Case Management.
Yes.
You've been experiencing some PTSD as a result of being involved in a hostage situation 9 months ago.
Yes.
That would have been very difficult. This is you're being treated by medication and treatment from a psychologist, Sean Martin, and Pierre. You also report that since your childhood you've had feelings of mild anxiety in social situations that involve communicating with new people face to face, and that you feel stressed in both social situations and work related. In which time management is then an issue as well. Is that right?
That's pretty accurate, Maria.
Yeah.
Yes.
So your goals about addressing and controlling your social anxiety, so you're able to engage in your day-to-day interactions with other people without feeling any discomfort or concern. And you'd also like to learn some adaptive stress management techniques and time management skills.
Yeah, to help with my social phobia.
And you've got a social phobia.
Yes, Maria. Yeah. I've always had it.
Yeah. Would you like to talk to me a little bit about that?
Yeah, I've had it all my life, basically. I get withdrawn.
Yep.
I don't like interacting with new people.
Yep.
I don't currently have a girlfriend.
Yep.
I'd like to have one in the future, being 32 years old.
Yeah, okay.
Been speaking to to Sam, and I realised that I need to get my life on track.
Yep.
And overcome these things.
Yep.
And being in the hostage situation in the bank wasn't very helpful either. Having someone hold the bank up at gunpoint and being held there as a hostage has really, really pushed me back.
Yeah, I would
so
imagine
Sam's been helping me. He's got me on medication at the moment. I know that medication isn't a long-term viable solution.
Yeah.
So he's referred me to come and see you
to
help me get over my phobias and get my life on track. And 32 years old, I said to him, I need to grow up.
Yeah, okay. Yeah, okay, fair enough. And how have you been going since you've been seeing the psychologist?
Yeah, not bad.
Are you finding benefit by seeing him?
To some degree, yes. But I just think I need some outside help with him being a psychologist. I think I need the counselling more than a psychologist.
And
if that makes sense.
Yeah, and learn some strategies and things like that might be more beneficial.
Yes.
Yeah. I think it's really good that you've been able to recognise that your hostage experience has really set you back quite a bit. I think that would be quite normal for anybody, out of all honesty, because how could it not affect you?
Yeah, I was worried I was going to die, to be honest.
Yeah, absolutely.
Especially when I had that Link Cafe in Sydney siege.
Yeah.
That all came to my mind, but are we going to get out of this alive?
Yeah, absolutely.
But obviously I did.
Yeah. And that would be a very, very vulnerable position to be in.
Yes.
Yeah, I could understand. Yeah, that would be horrible. So is what I think we'll do. Are there any other issues that aren't in your plan that you would also like to address?
No, I think Sam's put it all in there. I had a good conversation with him before he did that, and his clinical notes are very accurate on what I want to do.
Great. If there's anything else that comes up, please let me know, okay? And we can add them to it as well. Was there anything that sort of happened as a child that made you feel more withdrawn? How were you like at primary school with socialising and your friends and things? Was it difficult then?
It was difficult then too, so I had this all my life.
So was there a particular instance or something that may have brought this on?
Look, going back to like 4 or 5 years old, it's very hard to go back that far.
Yeah,
I could probably say I was bullied at a younger age. maybe a little bit awkward, a little bit of a shy child,
Yeah.
picked on.
Yeah.
And my coping strategy was just to withdraw within myself.
Yeah.
And I've been doing that for the past 20 years, Maria.
And it hasn't served you very well as a whole.
Time to snap out of it. 32, I'm no spring chicken anymore. I want to settle down, get married and have kids.
That's beautiful.
Yeah.
Yeah, fair enough as well. Have you had many girlfriends in the past, though?
No, Maria, no.
So,
Big shot,
yeah, so that you don't quite have the experience there. That's okay too.
I just want to get my life on track.
Yeah. That's fair enough.
That's it, Maria.
There's nothing wrong with that either. Sometimes it just takes a couple of one instance that sort of can throw us a little bit off kilter sometimes too. Okay, so it's what we'll do is that in your individual plan, we've got some counselling for the 8 weeks. So we will do a contract for the next 8 weeks, and around week 4, I will get you to do a feedback form about how you think you're going, your goals. Are they being met? They're not. What do we need to shift and change with that? And what I will also do, I'll work closely with Sam as well, and also your psychologist, so that we're all stay on the same book, and that we're all working towards the same thing. So I will keep them updated on your progress and how we're going in our sessions as well. Is that okay with you?
That's fine. You can also talk to my mum if you need to too.
Yes.
My mum's Roma. She has permission too, I think.
Yes, she absolutely does. You would like her to be involved in all aspects.
Needed, yeah.
Okay. There hasn't been any past where there's been thoughts or anything of harming yourself?
No, Maria.
All right, so you're nowhere near that side of things. Okay, perfect. All right. So I think is what we'll do, because we're just finishing up our session now, is that you've given me a good idea of the things that you'd like to work on and who I need to sort of also work with, which is really good. And then as of next week, I think we'll get stuck right into our session.
Okay,
How does that sound all right for you?
Sounds good to me, Maria.
Yeah, all right. And if there's anything else that pops up between now and next week, write them down, bring them with you, and we can always add them too.
And I suppose too, if I need an emergency with you, I can make it one before next week if I don't cope.
Absolutely. Or you just ring and just and see if there's some spots available or something.
You, Maria.
But yes, we can absolutely do that for you. All
All
right.
right, thank you.
My pleasure.
I'll let myself out.
Okay, see you. I just pressed pause while Mark just went and dealt with a work phone call. So now on to role play 2 with Beck. Hi Beck, how are you?
I'm okay, Maria.
Thank you for coming and talking with me today and asking to come and see me.
Thank you for seeing me, Maria.
My pleasure. Tell me, because I've noticed that you're a lot quieter than what you normally would be. Is there something that's going on or something that's upsetting you?
Yeah, Maria, recently I was diagnosed with schizophrenia.
Okay.
And it was a bit of a shock.
Absolutely.
Yes.
How do you feel about it?
Schizophrenic.
Does it make you have... I know it's potentially can be a label.
Yes.
But does it give you a little bit more understanding about you and the way that you operate?
Well, it does when I look back now, because I'm 19.
Yeah.
I dropped out of school when I was 15.
Yeah.
I just couldn't cope with it all.
Yeah.
And I've never worked. I've never had a job.
Yep.
I basically live at home with mum and dad.
Yep.
And my brother.
Yep.
And I get some support and money from the government.
Is that Centrelink?
Yeah, it's like Centrelink.
Yep.
And maybe some NDIS. I'd have to ask mum what it is, but we get some Centrelink money. And I'm just worried, Maria, because I don't want to live at home forever with mum and dad.
Yeah.
I want to go and get a job and live by myself.
Yeah.
But because I left school at 15 and I've had no work experience, and now that I've got schizophrenia, I'm worried if I'm going to be labelled and nobody's going to employ me.
Okay. All right. So you're feeling down about your prospects?
Yes.
I suppose is the best way of being able
Yeah,
to
it's
put
not
it in
easy
your
to find a
future.
good job these days with the
That's
cost of
true.
living.
Yeah. I suppose the good thing is that you can at least still live at home with your family.
Yeah, for now, but not forever.
No, that's true. But still, whilst you're still in the early process of your diagnosis, is that you're getting the support and things
Yeah,
as
the
well.
medication that the doctors got me on is
Yeah.
helping, and it's under control, so I feel a lot better than I was when I was 15.
You're not getting any side effects or anything from the medication?
No, just a bit of bloating in my belly, but that's okay.
Okay, that's fair enough. That's easy to handle,
Yes.
isn't it? Yeah, okay. So since you've been on the medication, you're just feeling are you feeling like you're in more control
Yeah,
of yourself?
I am, yes.
Okay.
It's just a bloating in my belly, which when I get my period doesn't help either.
No, that just makes it so much worse
Yes,
sometimes,
Maria, it
doesn't
does.
it?
Yes.
Sometimes it sucks to be a girl.
Yes. Especially a 19-year-old with schizophrenia.
Yeah. It's only a condition. It doesn't have to define who you are. So don't allow it to define who you are, because it's not. Because your heart is what's most important.
Very true.
Yeah.
That's what Mum says to me. She gives me a cuddle and she says, to the moon and back, I love you.
Yeah, that's beautiful.
It is.
That's really nice. Let's talk about things. So you're 19 years old. You're really starting to think about your future and what you would like it to entail. So you dropped out of school at 15. Would that have left you with a year 10 pass?
No, year 9.
Year 9 pass.
I left before year 10.
Okay.
Mum wasn't happy.
No. I wouldn't imagine that she would have been, but sometimes we've got to do what we've got to do and what's right at the time for ourselves. And it was obviously very overwhelming for you to be at school and have the schizophrenia and that whole aspect going on. That would have been really challenging for you.
It was.
Yeah, as it would for most people. So
at least I got diagnosed, so I know.
Yeah, true. And the fact that you're now diagnosed, it's about learning how to manage yourself within your condition without it defining who you are. What is it that you'd like to achieve moving forward? What is most important for you? Is it to get a job? Is it to continue your education?
Both. To continue my education and to get some qualifications and to get a job. And I was talking to Dad last night too about all of this.
Yeah.
And I don't have to mention, but I have schizophrenia to employee because he said it's medical in confidence, they don't need to know.
Yeah, and there's that whole privacy element that goes with it. So, which is really good. And the trick is that you just constantly stay on your meds to keep you more balanced.
Yeah, the doctor said I'll probably be on that for the rest of my life too, Maria.
Yeah, well, that's okay. That's okay. Now, finished at year 9.
Yes.
Are you interested in going back to school?
Not to year 9, no, Maria, because I don't want to go back to school with a bunch of 15-year-old kids at 19.
No, I think it would be sort of like there are classes where you can go to, like TAFE classes and things that cater for people of all different ages, where you'll be able to get your high school qualifications. And they're often done at night time. Does that interest you?
Yeah, I was talking to Mum about that too, and maybe get an apprenticeship as a hairdresser too.
Absolutely. But look, perhaps what would be more important would be try and get an apprenticeship or just build up a little bit more of your education, which then opens you up that little bit more for further study.
I think I could look at both.
Yeah,
that's what Mum and Dad said. We were talking about it last night, and I could look at both.
You absolutely could.
Because I find it hard to study with my schizophrenia too, Maria, and retain things.
Yep. Fair enough. Would you like to try the two and sort of see how you go? Because there's going to be that element of you learning a lot more about yourself with your own limits.
Like Mum said last night, but maybe I should finish year 10 and then look at the apprenticeship after that.
Yeah.
Having a cook would be good too.
Yeah. Oh, you like cooking?
I love cooking for people.
Yeah, nice. Yeah. So for most jobs, you really do need to have that minimum of year 10 to get to really pursue anything. So,
And Mum said too, what you think too, maybe I could do some volunteer stuff too at
absolutely.
the RSPCA in my spare time. At least when I do a resume, if I get a job, then they can see. But I've been doing stuff in my spare time
Absolutely.
instead of sitting at home.
Playing the Xbox or...
No, the PlayStation, Maria.
The PlayStation.
Yeah, and TikTok.
Oh, fair enough.
I'm on TikTok. I want to be an influencer too.
Yeah, okay. Yeah. There's nothing wrong with that.
Yeah, it's good money in that, Maria.
Yeah. So if you're given the opportunity to do your ideal job, what would it be, as in career? What would it be? Because there's no reason that you can't have a career.
I was going to say an astronaut, but I wouldn't be an astronaut, Maria. No, I think I would like to get into the hospitality area and one day own my own business.
Okay, so you've given me potentially cook and also hairdressing apprenticeship.
Yes. Look, I think too, Maria, talking to Mum and Dad with schizophrenia, I'd probably better off being my own boss.
Possibly.
Then I don't have to answer to anybody and no one will be able to tell. Maybe.
Well, it gives you that element of control too, doesn't it?
It does.
Yeah. So perhaps maybe doing an apprenticeship as a cook of that sort would probably be a viable option as well. Okay, so let's put that down as part of your goals. So look at going back to school and at least completing year 10.
Yes, that's what Mum said.
Yep. And perhaps doing it as we'll see what's available, but I know there are definitely night classes. And also you've got a real interest in cooking.
Yes.
And having your own cafe.
Maybe.
Well, we can have that there. You could also go into a management of a cafe and things like that as well. But it gives you a good starting point, and there's no reason why you can't dream.
Thank you, Maria.
Yeah. Don't you think you deserve that?
Yes, I
think
do.
So is what we'll do... at the end of the session, I'll give you some information on a few different options from an education point of view to at least finish year 10. Go home, have a talk about them with Mum, have a bit of a think about it, and we can definitely assist in helping you with that as well. And I really like that idea about doing some volunteer. I'm just wondering, instead of heading towards the animal sector, which would still be awesome, maybe doing some volunteer work in that hospitality aspect, or whether there is a potential course that you could also be doing as well as while you're doing your year 10 that starts honing you around that cook hospitality area.
That's funny you said that, because Mum said that too. Maybe I could go to an old person's home and see if I could volunteer there helping and help the chef in there.
Well, there's also food kitchens. There's a whole range of different aspects from a volunteer perspective.
Well, there you go, Maria.
Yeah.
That's why you're the counsellor.
So why don't we put that down as one of your goals as well?
Yep.
Volunteering sort of in that cook hospitality. But I think it might also be worth, if you're comfortable with it, is seeing if there's any courses where you could essentially do a little bit of that. So you may find it's too much, but then you can always pull back. You can do some sort of a course or volunteer during the day and do your schooling at night. Might just depend on what's available.
Yep. I could do that RSEA course too, Maria.
Absolutely, you can.
And get a job pouring beers.
Absolutely, and I think a lot of that you can also do on
online. Yeah, I looked into it. It's like $150.
Would you be able to consider that? Would you like to consider that?
Yeah, I can ask Mum.
Yeah.
She might make a few small chores around the house to pay it off.
There's nothing wrong with that. And it helps her all at the same time, and it gives you a purpose.
Yes.
That's a win-win for everybody.
I'll do her laundry, Maria.
That sounds like a really nice plan.
$10 a basket for memory.
Well, I think that's a really good start to get your future all starting to happen. Are there any other aspects in which you would like some support with?
No, I think with the medication that the doctor's got me on has made me see clarity better with the schizophrenia, and now I can come to make these decisions without worrying that I've been watching someone's looking at me all the time.
Yeah.
And I want to do something bad.
You've never considered doing anything or doing any harm to yourself at any point, have you?
Oh, maybe with schizophrenia in a long time, but it's been resolved now.
Okay, so that's nowhere there.
The doctor did ask me that before.
Yeah. Okay. Fantastic. And you know, if you start going down that route,
I'd see Mum.
Yeah.
So, Mum, I need some help.
Absolutely. All right. But I think it is quite paramount. Is keep doing exactly what you're doing because it's working at the moment. That's for sure. And just remember, you do have your rights from a privacy perspective, confidentiality, and everything with where you go moving forward. All right.
Yes, because you can't tell anybody.
No, absolutely.
Very good.
Absolutely. All right. How does all that sound for you, Beck? Does that sound exciting?
Yeah, it's very exciting.
And you're happy to look at that? Well, and I'll send you off with a heap of information. Have a look at it, do some homework, and I will see you again next week.
Thank you, Maria.
My pleasure. See you.
Bye-bye, Maria.
Bye.